Hello, good afternoon.
Hi.
Hey Shane, how are you?
Good,
How's
how
it
are you?
going? I'm very nice meeting you. So, what's going on, buddy? What brings you here today?
My wisdom teeth are starting to bother me.
Okay, which one's been bothering you?
So, mostly this one.
Okay, lower right?
Yeah.
Okay, I can definitely see what's going on, and what I'm gonna do right now, I'm gonna go over, position of your wisdom teeth and reasoning why the wisdom teeth need to come out, and also I'm gonna discuss procedure-wise, how we're gonna do the procedure, what to expect after the procedure, and I'm gonna take care of you. Sounds good? All right, so looking at your wisdom teeth right here, this is a panoramic x-ray, this is your top jaw, this is your lower jaw right here, this is your right side, and this is your left side. It's like you're looking at us through the screen. Starting with your lower right wisdom tooth, this is the guy that's been bothering you right here, and as you can see that there's not enough space for this tooth to come out nice and straight, therefore it's going sideways, and by growing sideways, this tooth, first of all, is causing a lot of pressure on the tooth directly in front of it, which might cause some irritation. Also, we are worried about over time shifting in the teeth, because weakest teeth are the lower front teeth, so it's almost going to be a domino effect that eventually you're going to start noticing shifting on your lower front teeth, and also you will get a lot of bacteria and food particles getting jammed or stuck. And let me zoom it in for you. Right in this area, right here, this triangle, black triangle, that food particles would get stuck here, cause some irritation within the gum tissue, and you could see that there's a little darker triangle right here that might indicate that bacteria colonies are brewing over there. My concern is not the wisdom tooth itself. Honestly, my bigger concern is the tooth directly in front of the wisdom tooth, because this might start creating a cavity or damage to that second molar. So this is your your lower right wisdom tooth. Looking at your lower left wisdom tooth, same situation. Even might be a little more impacted. And you can see that this tooth is growing sideways. It's causing a lot of pressure on the teeth in front of it, first of all. Food impaction and bacteria getting stuck right in this area, which is almost impossible for you to keep it nice and clean. You might start developing a cavity on the tooth in front of it. Therefore, lower left wisdom tooth needs to come out also. All right? Now let's look at the top ones. Your top wisdom teeth are almost identical in position. This is the upper right, this is the upper left, and you can see that they are a little higher up, reason being there's not enough space for them to come out into normal position, and that's why they're stuck there. Even if you draw a straight line and say, okay, let's see, if I draw a straight line right here, where's the tooth gonna go? It's not gonna go anywhere because it's already hitting the second molar in front of it, and therefore what's gonna happen with that upper wisdom teeth is that they're going to start deflecting backwards, or eventually they're going to come out, but they're going to start peeking out from the side of the gum tissue, which is really irritating and would cause a lot of inflammation, irritation, and therefore more issues, more problems. That's why, lucky you, my friend, 4 of the wisdom teeth will need to come out. Alright, I'm sure you knew about it, you had a feeling.
Yeah.
Alrighty, so let's talk about the procedure itself. Of course, I always recommend, in order to take out, when you decide to take out the wisdom teeth, get it over with, take 4 out at the same time, so you won't have to worry about, coming back and forth. And second of all, it's good to be sedated, asleep for the procedure. Of course, you shouldn't have anything to eat or drink, at least 8 hours prior to the procedure, and somebody got to be driving you back home. So, is somebody driving you back home?
Yep, my family's coming in, and haven't eaten all day.
Oh,
So,
good job. 3:30 p.m. having anything?
yeah.
Good man. I would have never done that. I would prefer to do it in the morning. All right. So procedure-wise itself, what I'm going to do is I'm going to end up putting you back a little bit. Start by giving you some of the nitrous oxide, which is the laughing gas, silly gas, along with oxygen. That's going to give you a nice buzz. You're going to be relaxed a little bit before I start an IV. And that's how I'm going to be giving you the medications, the IV medications through the IV line. As soon as I start the IV line, I'm going to give you some medications to the point that you're going to be asleep. You're not going to remember, you're not going to know what goes on, you're not going to hear anything, you're not going to see anything. Before you know what, you'll be waking up, procedure will be totally done. It's going to take me roughly about 35 to 45 minutes to extract 4 of the wisdom teeth. For you, it's going to feel like a second or two. All right, that's a good thing about it. So now, while you're sleeping, I'm going to take out the teeth, I'm going to clean up the areas really well, I'm going to put dissolvable stitches to close the area really nicely, alright? When you wake up, you're going to be feeling a little sleepy, you're going to be feeling really numb since I'm going to numb you up while you're asleep for two reasons. Reason number one, to control any bleeding that might be present.
Okay.
Reason number two, so when you wake up, you're going to be nice and numb and comfortable. You won't feel any discomfort. It's good to be numb for first few hours after the procedure also, alright? So, when you wake up, you're going to be feeling really sleepy and really numb, alright? Numbness should last for about 3 to 4 hours after the procedure. After the numbness wear off, you might develop some discomfort. Everybody reacts differently. Some people might have, very mild discomfort. Others have a lot of discomfort. That's why I'm going to be giving you 2 kinds of pain medications. First pain medication is a non-narcotic anti-inflammatory medication you're going to take around the clock. It's going to help with inflammation and it's going to help with discomfort. I usually give Motrin 600 milligrams or 800 milligrams. Second medication is a stronger narcotic medicine. It's going to be used only as needed. If you have a lot of discomfort, you take it. If you do not have discomfort, no need to take it. Just stick with the non-narcotic. So it's good to have backup pain control medications, all right? Especially, at 3 in the morning, instead of trying to reach me and, going to the pharmacy and all that, it's good to have those medications with you, all right?
Okay.
Now, other than the pain control, which will be controlled, expect some swelling. You're going to start noticing little swelling the day of the surgery, and then a few days after, you're going to be really swollen, okay? Everybody, once again, reacts differently to the swelling. That's why we're going to be giving you medications to help with the swelling, along with the ice packs, which are going to be, placed around your cheeks. The more ice you use today, which is the first 24 hours, the less swelling you're going to be getting. All right.
All right.
Food-wise, you're going to be limited with food intake. You would have to stick to soft diet, anything that does not require opening wide or chewing that much, anything that you could take in and swallow right away. Once again, it's going to last for about 2 or 3 days, and then you're going to start tolerating better foods. So you could advance it as tolerated with the food.
Okay.
Okay? Chances of infections. There's always that very, very slight chance of an infection. That's why we're going to be giving you antibiotics also to prevent any infections from happening. Okay? Your top wisdom teeth are a little closer to the sinuses, so there's an extremely low chance of developing an infection within the sinus. That's why we're giving you antibiotics to prevent any infections.
Okay.
All right? Your lower wisdom teeth are slightly closer to the nerve that gives sensation to your lower lip. There's a big nerve called the inferior alveolar nerve that runs right within the jawline, and that nerve gives sensation to your lower lip. So let me zoom it in to show it to you. So if you look real carefully, here's your lower right wisdom tooth, and can you see this line right here?
Yeah.
That line is the canal in which our nerve runs right through that area. And as I said, this nerve gives sensation to your lower lip and chin area. So when I take out this wisdom tooth, bruising around the nerve might cause the nerve to be numb for a little longer than expected. On average, as I said, you're going to be numb for about 3 to 4 hours. There's a chance that numbness might last 8 hours more, or even 8 days more. I cannot tell you. It's just a matter of giving it time for, giving it time for everything to settle down. Chances of this happening is very low in your case. Reason being is that your wisdom tooth is still developing, and the roots of your wisdom tooth are not complete yet, so they do not have any curves, or they don't appear to be going through the nerve. They're just terminating on top of the nerve canal, and that's why this is, chances of you being numb for a little longer than expected is extremely low. But it's good to keep in mind that if you're numb for a day after, 2 days after, say, you know what, it's fine, Dr. Rabai explained it to me, it's a very low possibility, but it's just a matter of giving it time to see what happens. Good deal?
All right.
All right, so overall, I explained everything to you. Do you have any questions for me whatsoever?
I think I'm good. I think you covered all my concerns.
Good deal. So just give me a minute. I'll be right back so we can start. I'm going to call my assistant. I'm going to put monitors on, and I'm going to start the procedure. All right?
All right.
I'll be right back. All right.
Thank you.